Good morning. Hello. Hi. How are you? Welcome to another podcast by George. We're going to go live this morning because we've got an historic event here in the heartland and really across the entire United States and across parts of the world. The COVID-19 coronavirus vaccine is in the house. I mean, it's at hospitals getting distributed. And we've got some here, and we wanted to bring in our medical expert, Dr. Andrew Nish, to talk about what's happening because I was talking to him in the green room, as we call it, before we came on the air. And this thing really strikes me as kind of like a 9/11 moment. I remember when I got vaccines as a child. Of course, I'm old enough to remember very clearly the day Kennedy was shot. This is an historic moment, folks, and it's happening as we speak. And that's the reason we wanted to go live. Let's welcome in Dr. Andrew Nish. Good morning, Doc.
Morning. How are you?
I'm doing great. Okay, you've been out and about. You're a witness to what's happening. Kind of give us a little word picture here. Describe what you're seeing.
So yesterday morning, about 10 o'clock, the first vials of vaccine were delivered to Methodist Hospital in Des Moines, and vaccination started this morning.
And it's frontline health workers first. Right. I think second, have they decided for sure that it's going to go into the nursing homes? Is that the protocol?
Yeah, that's, so we're following CDC protocols. So it's frontline healthcare workers, people in the ICU, people in the ER, people taking care of the COVID patients, and then long-term nursing home residents. So right now we're just vaccinating, as far as I know, our people in the hospital.
Now, let me just read this briefly. I want to bring this onto the podcast. This was the latest reporting from the Des Moines Register and the State Department of Health. As of Monday, 3,723 COVID-19 related deaths in Iowa, an increase of 60 deaths since the state's tally Sunday. That's according to the state's website. The state reporting at 10 a.m. Monday that there were 256,913 confirmed cases of coronavirus, an increase of 665 since 10 a.m. Sunday. The total number of people tested, it's 1.3 million, according to the state. Of the people who have tested positive, 190,222 have recovered. Okay, I know why I included that in there. I kind of had a bone to pick. I wanted to check with the doc on this and see how he feels about that, because that's standard. I mean, this is just a standard news release that they're using. They always talk about the vast majority of folks recovering. Yeah, they don't have it as bad as they did, and they didn't die in that type of thing. 190,000 have recovered. But, Doc, do we know for sure, particularly with this long hauler situation? I saw this report on 60 Minutes. I mean, do we know that those people are recovered? And if we don't, why do they report that number?
What does recovery mean?
Yeah.
So that's sort of a moving target definition from what I can tell. And, people are going to recover, and then we're going to learn over time this sort of long hauler syndrome with lingering side effects. And, it's just going to take time to understand how many people, what percentage of people who recover from the virus actually have these symptoms. And, time is going to tell on that. Frankly, these statistics bother me a bit, because where are they coming from? What's our definition? How come yesterday was reported one death, and then, the next day we have 60 deaths? How are deaths being reported? It keeps changing. We've changed the definition, how deaths are reported recently. So, we have to take these exact statistics with a bit of a grain of salt, but we have to look at the overall picture. Are we improving in the number of COVID cases, and are we lowering the number of deaths? And so I look at it as large scale trends and not worry about the individual numbers. So if you look at the trends for the last 7 days, our numbers of cases are actually going down. We peaked at 5,000 or something. We're down to 1,200 or 600, whatever it was today. And I think that's good. If you look at our hospitalizations, we peaked in the low 130s. We were at 84 yesterday. So certainly our hospitalizations are down. Everybody was worried about this peak after Thanksgiving. Yeah. And again, this stuff is regional. So you can go to other areas of the country and they're struggling. We're doing a bit better right now. But again, we still have to emphasize, just because we're doing better doesn't mean we're out of the woods with this thing. And just because we have a vaccine available, we are a long way from immunizing enough people to get out of the woods.
Well, Doc, you're not as old as I am. You're pretty close. I mean, you've spent your entire life in the medical profession. You've been around these heroic frontline workers. What's their response or reaction now to getting the immunization? Now, what's it like? Is it a zippity doo dah moment, or is it something they just need to know that they have to do and get it out of the way so that they can continue to do the work that they're doing? Or I guess maybe what's the morale like on this?
Yeah, you know what? I don't know. I haven't been to the hospital. I haven't talked with any of the frontline workers in the last couple of days. So I don't know from a personal aspect. I think, from being in the medical profession, nobody's dancing in the streets, but people are maybe breathing a bit of sigh of relief, like, okay, we're moving forward. We can see some light at the end of the tunnel, but we still have a long way to go.
And I think about those folks, and they show those pictures, and I think mostly because they are so dramatic. But a lot of the pictures that we see are these folks in moon suits. I mean, they're wearing these really heavy-duty protective outfits, and the visors in particular, and the helmets, and some of them, I think, have oxygen tanks on and all that. Well, the main reason I would look forward to getting immunized if I was one of those folks is I wouldn't have to wear all that stuff. Are they going to be able to shed some of that protective equipment, or are they still going to have to wear it?
They're still going to have to wear it. So, you're getting the vaccine. But again, remember, this is a 2-dose vaccine. You're not going to achieve full immunity for at least 6 more weeks because you got to wait 3 to 4 weeks for the second dose. And then it takes a week or 2 after that. So full immunity is not going to be conferred on you in the next few days. It's going to take up to 6 weeks. The other part of this, and we talked about this earlier, is what we don't know. There's 2 things we don't know. So if you receive the vaccine, can you become infected but not have clinical symptoms?
Yes.
Meaning, do you have competent replicating virus in your nasopharynx, but you're not getting symptoms because you're protected? We don't know the answer to that. The second part of that is we don't know the answer is if you do have competent replicating virus in your nasopharynx, is there enough of it to be infective to other people? And we don't know the answer to that either. It will take time to sort that out. So since those are both unknowns, we still have to protect other people from us, and we have to protect ourselves from other people. So mask wearing is not going to go away. Face shields are not going to go away until we have at least probably estimated 70% of the population either infected or immunized. So unknown answer, we don't know the answers to those 2 questions. We will learn the answer to those 2 questions over time. But for right now, what we do know is if you receive the vaccine and you receive 2 doses, not 1, but 2, there's a 95% likelihood you will be protected from having clinical symptoms of the virus. And that's all we can say right now.
I mean, that's really amazing. And that kind of leads to the next question. I wanted to ask about the efficacy rate. That 95% is just astounding, particularly because what we're most used to is the flu vaccine. And it's not anywhere near that. They tell you that it's 50%, sometimes 70%, that you could still get the flu. You have that 95% rate, which is just jaw dropping. And then that's the efficacy thing. The speed with which this vaccine was developed. I mean, when you and I first started talking, I don't think you thought it was going to be in your hospital right now, but it is. Talk about that.
Yeah, I've listened to a lot of podcasts with a lot of really smart people who have been in this business for decades, and every one of them says they are absolutely astounded that we did it this fast. And that's not to say we did it sloppily. That's not to say we did it poorly. It just is mind-boggling that we developed a vaccine this fast. Now, there is a backstory to this, though. So people have been working for years and years on using messenger RNA injected into a cell to change, to combat some disease. So we've had that science going on in the background for quite a long while. The real problem was, how do we actually get that messenger RNA into a cell? It's a very fragile molecule. And so we were able to develop these carrier nanoparticles, which are basically fat, to get that messenger RNA into the cell. So the background work has been done for years and years and years. And these scientists should be recognized for what they did. And some people said, people who have been working on this mRNA should be awarded a Nobel Prize because it's that important. And so for the first time, I think the first time, we've now been able to clinically take that bench science and apply it to a disease problem. And so it's just hats off to everybody who's worked on this. They've worked incredibly hard, incredibly long hours, incredibly smart people to understand how to do this. And every scientist in the world is really surprised at how quickly this happened and how well this vaccine has worked. I mean, the FDA was hoping for 50% of efficacy.
Yeah.
95 is on the order of what a measles vaccine does. So, people are skeptical. Well, this happened too fast. What they need to understand is this happened fast, but the bench basic science has been going on for a long time.
I find it is just hard. It's hard to believe, actually, for a cynic like me, particularly. But 95% of the people that go through the regimen, they're going to be they're not going to get coronavirus. You're in a 95 to a 100% range.
You're not going to get coronavirus. We don't know that. You may be infected. What you're not going to get is the clinical syndrome.
Oh.
Okay. So you could possibly still be infected. And that's, remember, what we don't know. Do you have replicating virus in your nasopharynx? You just don't have the symptoms. And I don't mean to nitpick, but I think we have to be absolutely clear that this vaccine is not necessarily preventing infection. It's preventing the clinical syndrome. Okay,
so just to go through this process, because it's simple, but it's a little bit complicated. Those people that just got that first shot, they're immunized. They have a certain degree of immunity right now, correct? Or is it take a while for it to kick in?
Well, not the day after. It's going to take a week or two to develop any type of immune response or antibodies. But again, we have to remember that's not full immunity that was studied in the clinical trials. So people have speculated, well, if I get one dose, am I 50 or 70% likely to be immune? And I don't even like to answer that question because that's not what was studied. What was studied is after 2 doses, 3 to 4 weeks apart, people were able to achieve 95% efficacy, meaning they had a 95% chance they wouldn't get the viral syndrome. So we want to emphasize that this is not a one-shot deal. It's 2 shots.
Well, and if you're the world's most unlucky poker player and you fall in that 5%, is it kind of like the flu vaccine? Even if you do happen to get it, you're going to get it less severely since you went through the regimen?
Yeah, that's a good question. So I just looked at some data on the Moderna vaccine this morning, and there were 34 people out of how many ever tens of thousands they vaccinated that got severe COVID that required hospitalization and oxygen. All 34 of those were in the placebo group, the non-vaccine group. Nobody in the vaccinated group got severe COVID. So the short answer is yes, we believe that even if you're the 5% unlucky person, it's very, very unlikely you're going to get severe disease requiring hospitalization and oxygen therapy or intubation.
Well, science is on our side. This is all great news, obviously. It's a great day. It's an historic day, and that's the reason I wanted to do this podcast now and do it live. Let's talk about something everybody's talking about, Doc, which is the potential side effects to this. A lot of people really wiggy about side effects when it comes to anything. And, people like that, too. They can't take an aspirin without ending up on the floor. Well, what about the side effects with this vaccine? Mild to moderate, we hear sometimes. And the second question is, do you get those side effects with both doses?
So mild to moderate side effects, what does that mean?
Yeah.
Pain at the injection site, muscle aches, maybe a low-grade fever, 24 to 48 hours. Those side effects appear to be much more common after the second dose. But you know what those side effects are telling us? That your immune system is doing what it's supposed to do. It's cranking up. It's working to make antibodies and make killer T cells to combat this infection. So, those side effects, when you look at the data and you look at people's description, they are mild. Some people do take an anti-inflammatory and antipyretic for 24 hours just to relieve those symptoms, but they almost all go away within 24 or 48 hours. So we have to put up with it. It's okay.
Well, let's talk about allergies, because that news came, I think, out of Europe, out of the UK. A couple of people over there had real problems that were allergic, and I'm not the world's best guy to talk to on this, folks, because I'm weird. I don't have any allergies. I've never had any, and I have a tendency to look at it and go, "Oh, what are allergies?" But people that have them, and my wife does, they're very real. For instance, she's allergic to penicillin. My God, if she gets even around that stuff, almost, it can kill her. It's unbelievable what some of these allergies are like. Well, what allergies do you need to be concerned about if you have them, and how does that come into play here with the vaccinations?
Yeah, so in the UK, 2 people developed a severe anaphylactic reaction, meaning swelling, hives, things like that. I don't know the exact what they actually got. And they had a history of severe allergic reaction to other things. So what does that mean for vaccinating? It does not mean that anybody with an allergic reaction should not get the vaccine. But if we want to look at it from a pragmatic standpoint, if you have a significant allergic history, and that doesn't mean you get a little rash when you eat something, or you get a little, you take a drug and you get a welt or something. These are severe reactions where you get throat swelling, facial swelling, difficulty breathing. If you want to get vaccinated, then you want to get vaccinated at a site that has resuscitation and responding equipment. Don't go to Walgreens and get the vaccine. Go to the hospital and get the vaccine. So that's sort of the pragmatic way to sort of handle this situation. The other thing is there's this tremendous power of our brain to influence what happens to us. So if you have in your mind, I'm going to get a reaction to this, I know it's going to happen, probably going to happen. But if we can just say, you know what, this is a great vaccine, I know it's going to work, and I'm not going to have any reaction, probably won't. Power of the mind.
Yeah, of course, like I said, I tend to think that way. But my God, my wife, she was in anaphylactic shock with penicillin at one time when she was very young. So she has to be very careful about that. And of course, there's no baseline here. There's no study group, because you had 2 people that had it. I'm sure that their allergies or whatever their histories were not similar. So
you have to also look at the trials that were done.
Yeah.
People with severe allergic reactions were excluded from the trials.
I see.
So they were not included in these trials.
Yet, my wife's a good example. Again, she can take a flu shot, doesn't have any reaction to that, but this is an entirely different kind of thing. Can you even speculate as to how or why this would cause an allergic reaction based on the type of vaccine that it is?
Well, it's not the type, it's how is it compounded? What are the other, a lot of vaccines contain egg product. A lot of vaccines contain other things people are allergic to. So I think we'll sort this out as we go, because we will find people are having, an allergic type reaction. And so we'll begin to sort that out, and maybe even begin to figure out, what part of the vaccine, because it's more than messenger RNA. There's lots of other compounds in that vaccine. What part of the vaccine are they actually allergic to? And a lot of allergies, so, you'll have people with, let's say, lidocaine, which is a local anesthetic. They're allergic to lidocaine. Well, it turns out they're not allergic to lidocaine. They're allergic to the preservatives that are in lidocaine. So just because, somebody might be allergic to penicillin, are they truly allergic to penicillin, or are they allergic to something else in the compound? So it's going to be, sort of a search and destroy. We'll figure it out, but it's going to take time, and it's going to take lots of people to figure this out.
Let's talk time. Let's talk logistics a little bit with this vaccine coming in. You're getting the frontline medical workers vaccinated here first and foremost. It's starting to come in. Are we prepared to take all the vaccine that we need to get all those workers covered, and then to go to the next step, which I think is the nursing home? And then is this going to happen so that we can roll it out then to the general population, maybe beginning with the elderly and maybe the healthy elderly? How's that all going to work?
Well, the CDC has set forth guidelines of, priority guidelines. Each state is kind of on its own with that. And so, frontline healthcare workers are going to be first, and then certainly long-term nursing home residents are going to be next. And, if you look at the general population, you and I, we probably won't be offered vaccines until late March or April. That would be my guess. Okay. And I was listening to Anthony Fauci the other day, and that's sort of, his timeline as well. Another person I was listening to, which was Paul Offit, he's a vaccinologist out at the University of Pennsylvania Children's Hospital. He thinks that our capacity to vaccinate is about 5 million vaccines a week. So if you look at long-term nursing home residents and healthcare workers, that's about 25 million people. So that's 5 weeks worth of vaccines just to get those people done. And then you're going to, do the next level, which I'm not sure, we know exactly what the next level is or when that's going to happen. But this is going to take months and months. And, most of us hope that we have enough people vaccinated to achieve this sort of herd immunity by late summer, early fall next year.
Godspeed. I hope it comes sooner rather than later, because I'm getting buggy. I mean, thanks to you particularly. I mean, I'm holding up maybe better than some folks, but I'm ready to change my life up a little bit, and that would be great. I would like to see that happening. Well, I wanted to talk on logistics also. We see all of the news coverage, TV news in particular. They keep showing these freezers and these freezer doors and people putting in crates. I mean, okay, I got it. It goes in a freezer. Well, you guys have got those at the hospitals. What about these nursing homes? Do they have freezers? Do they have to bring those patients to you? Do you have to go to them? How's that going to work?
You know what? That's kind of dependent on the nursing home, and I don't really know the answer to that question at all. Most nursing homes are not going to have the capability of freezing something at minus 90 degrees.
Yeah.
And they may have to send people to the hospital. Other places, we're also talking about taking it on the road. So taking freezers on the road and going to different facilities and vaccinating. So, that's all kind of at a regional level. And those are logistics that we're working out as we go. So I don't really have a great answer for that one. I don't know what the nursing home capabilities are, and they're going to be different for each one.
Saw a guy on Twitter. You got to be real careful what you see on Twitter, folks. But this guy said, hey, we've got those blood mobiles that go out around to the rural communities and that type of thing. Throw a couple of freezers in that and some vaccines and head out around the country like we do with the blood mobiles and vaccinate people in their hometowns. I thought, well, that sounds like a good idea, but I don't know, Doc, does that sound like a good idea to you?
You know what? This is going to be evolutionary, meaning we will learn as we go. We'll learn the best way to get people the vaccine. And so I just don't want to have, we're going to do it this way, because we're going to learn what works and what doesn't. And so I want people to be flexible and open. One day it might be everybody has to go to Walgreens to get it. The next day it might be, hey, we're going to make these mobile units available, and we're going to be in a community on any given day. Here's the other thing we have to remember, though. It's not as simple as just sticking a needle in somebody's arm. We have to have a mechanism for tracking those people. When did you get the vaccine? Which vaccine did you get? And when are you due for your second dose?
Oh, yeah.
So you have to remember that, too. So it's not as easy as just one shot. See you later. It's one shot. Now we've got to track you and get you your second dose. So these are incredibly complicated logistics, and we're going to lay the best laid plans possible, but I can tell you those plans will change over time.
Let's have a little personal responsibility here, folks. I mean, you'll probably be contacted. They'll reach out to you, particularly to get that second dose after you get the first. I know they do that with like the shingles vaccine. They did that for me. So you need to come in and get the second one. But my God, we're going to need to take it upon ourselves to get the dose, get the second one, keep track of this. I mean, do it right, get vaccinated. And I don't know. I'm just thrilled like you are. I know everybody is.
To me, most everybody's got one of these things, right?
Yeah, good point.
You get a vaccine. You put the date on that vaccine. You then put the date when you need the second dose, and you put a reminder on your phone. I mean, we have this technology. We have this thing called a phone, an iPhone, a smartphone, whatever it is. Use it. This is a perfect opportunity to put that in and be responsible for reminding yourself, I got to get that vaccine on, January 15th, whatever it might be. So, I think we have great ways. And, we're going to be tracking everybody who gets the vaccine. There's actually an app, and you can download that app on your phone, and you can report any side effects that you have, and that information will immediately go to the CDC. So I would encourage everybody, let's use this marvelous technology that we have, and let's remind ourselves when my next vaccine is, and let's use these apps so that we can accurately track all of these potential problems. And I don't say we're going to have a lot of potential problems, frankly.
Well, that's great. And again, it's an historic day, folks. I mean, it's like the 9/11 tragedy, the moonlight, or the moon landing, moon landing, thrill of that, the tragedy of the Kennedy assassination. I remember all those things. And of course, I'm old enough, Doc. I came just right after the scourge of polio, basically. Maybe it was the first little generation of kids to do that. But I've got some personal experience with that because I had a classmate that had polio. Met her in kindergarten and graduated from high school with her. One of the most heroic people that I know. Never complained, never made a big deal about it. Lived her entire life that way, but she just missed the polio vaccine apparently and suffered from that. So I've got a little personal benchmark. Well, I got to go. I got to let you go because I know you've got some things to do yet today. I want to give you the last word because you're good at them. Give us give us a little wrap up here, Doc, as we head on to the live edition of Podcast by George.
Yeah, 2 points. Number one, this vaccine is not going to mitigate the use of masks, social distancing, good hand hygiene. Okay, it's not. I get the vaccine and I can shed my mask. No. We have to continue to practice masking, social distancing, personal hand hygiene for at least another 6 to 9 months until we get enough people vaccinated that we get herd immunity. And number two is, I'm going to go back to, you've commented, I gotta change my life. I gotta get out of this. And we are in this now. We are in this for the next few months. And so learn to be comfortable with it and be creative and find ways to be comfortable with it. It's beautiful outside. We go for walks in the snow every day. I was out on my bike the other day, and there are just ways to continue to enjoy life. And if we're constantly in the mind frame of should have, could have, what if, what's going to happen, then that's what's going to dominate your life. Let your life be dominated by what's in the present moment. Don't fight reality. That creates stress and anxiety. The reality is we are here now in this, but there's light at the end of the tunnel. And that's okay to celebrate a little bit.
Yeah. Oh, that's great. Yeah. Worry about stuff you can do something about. I've always said that. I mean, there's, and so much of this we can't.
And please don't go out and have Christmas with 25 or 30 people. I just, and I know that I'm very lucky in my life because I have a wonderful wife and we get along so well and we do things together. And there's people who are lonely and are just hankering for community. And that's the way the human species is built. We need socialization. We need community. But maybe community is a Zoom call. Maybe community is a phone call right now. I don't want to put people's lives at risk. We've lost too many now.
That's well said. As always, folks, that's Dr. Andrew Nish. He's the medical expert for Podcast by George. I did this one live just out on Facebook with some friends because it is so timely. And we're going to send the recording out now to the rest of our platforms so that people can watch and hear this everywhere that Podcast by George is found. And you can get us on YouTube, iTunes, Spotify, out in a lot of Facebook groups. And I would encourage everybody to do that. And we'll try to do the best we can to keep abreast of all of these timely issues that confront us all. But that's going to do it for right now. That's going to wrap it up. That's all there is. And there ain't no more. That's another podcast by George.
Goodbye.
Yeah. See you, Doc. Here we go.